Hello, hello, hello. Mic check, mic check. Hello, 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 hello. Mic check, mic check. Are you?
1500 प्रीलोडेड गानों वाला कीपैड फोन धमाकेदार साउंड के साथ कारवा मोबाइल।
Start can.
A very good morning and warm welcome. On behalf of Mehta Institute of Cardiology and Research Center, I, Dr. Falakoza,
And I, Dr. Sagar Sahita.
we are honored to welcome our chief guest, Honorable Cabinet Minister of Gujarat, Shri Rishikesh Patel Sir, Minister of Health and Family Welfare, Higher and Technical Education, Law and Justice, Government of Gujarat.
And our guests of honor, Shri Dhananjay Dwivedi Sir, Principal Secretary to the Government, Shri Harshad Kumar Patel Sir, Commissioner of Health, Medical Services and Medical Education, and Dr. Rajendra Krumar, Secretary to the Government Industries and Mines Department.
Thank you so much, sir, and we welcome you to this highly anticipated symposium on global health, transforming lives beyond horizon.
In the August audience today, we have representatives of the Government of India and Government of Gujarat, directors and heads of departments of Medicity, BJMC Ahmedabad, healthcare professionals from different parts of India who have joined us, our esteemed foreign delegates and ambassadors, our senior doctors, and the entire guests of honor and UNMICRC family. Welcome to today's event on global health, and welcome to Mehta Institute of Cardiology and Research Center, one of the world's largest hospitals dedicated to cardiac sciences. With the progress in globalization, the matters previously confined to national policies have evolved into those with global impact and concern. Vasudeva Kutumbakam, Samasta Samsar Ekameva Parivar. The original saying is much longer, but it envisages two important aspects. The world is an indivisible entity, and all residents should be free from ailments. And India has always cherished this hope. It is my wish that today's discussions will lead to knowledge sharing, enhanced networking and collaborations, policy recommendations, and collaborative research and projects.
Without further ado, it is my honor to welcome and introduce our chief guest, Shri Rishikesh Patel Sir, Honorable Cabinet Minister of Gujarat, Minister of Family and Health Welfare Department, Higher and Technical Education, Law and Justice. Sir is someone whose vision and dedication has been instrumental in shaping our state's healthcare policies.
Under Sir's leadership, the healthcare infrastructure of Gujarat is reaching new heights. Where we sit today is part of the Medicity Gujarat, and under his leadership, Medicity is only growing further, with many more Medicities planned to come up in the future. His relentless work towards reduction of infant mortality rate, maternal mortality rate, increasing the awareness and occurrence of organ donation and transplantation is truly inspirational.
Please welcome and join me in welcoming Shri Rishikesh Patel Sir, Honorable Cabinet Minister of Gujarat, Minister of Health and Family Welfare Department, Higher and Technical Education, Law and Justice on the stage to have the inaugural address for today's event. Please, sir.
Let's welcome sir.
Good morning. Jai Shri Krishna. I am delighted to address you today on global health transforming lives beyond horizons. It is indeed a pleasure to see such a diverse and esteemed gathering of healthcare professionals and institutions, including both public and corporate hospitals, come together on one platform for global health transforming lives beyond horizons. This unity and collaboration will undoubtedly pave the way for meaningful discussions, knowledge sharing, and innovative solutions in global health. Heartfelt welcome to all esteemed ambassadors, distinguished foreign dignitaries, and renowned international guests who have graciously joined us today at Global Health Transforming Lives Beyond Horizons. Your presence is a testament to the global significance of these events, and we are delighted to share our visions for transformative global health initiatives with you. Welcome all to Gujarat, a state that rapidly emerging as a hub for medical tourism. I would like to put a information in front you guys that India's medical tourism sector was estimated to be worth $9 billion in 22, with approximately 2 million patients visiting India each year from 78 countries for medical wellness and IVF treatments. Gujarat, particularly Ahmedabad, has emerged as a hub for medical tourism and medical value travel, offering quality medical care at affordable prices. A report mentioned that most medical tourists in India comes from Southeast Asia, the Middle East, Africa, and SAARC region. Another report highlights that patients from the US, Africa, and the UK visits India for medical treatment, with cardiac diseases, orthopedic diseases, and gastro diseases being the primary reasons. Gujarat's medical tourism industries has been growing at an impressive rate of 30% annually, with the state contributing 25 to 31% to India's medical tourism sector. Our state-of-the-art hospitals, cutting-edge technology, and highly skilled medical professionals make as an attractive destination for those seeking quality medical care. Gujarat has emerged as a premier medical tourism destination, boosting a competitive edge over other states. Many hospitals in Gujarat have extensive experience catering to non-residents Gujarati and international patients. Notably, several hospitals have earned prestigious national and global accreditation such as Joint Commission, International GCRI, and National Accreditation Board for Hospitals, NABH. Ahmedabad, Gujarat's most influential city, has gained recognition as India's most renowned destination for medical treatments. The city's advancement in digitalization has enhanced the visibility of prominent doctors, surgeons, and hospitals, further solidifying its reputation. Gujarat rise as a leading medical tourism hub is a testament to its commitment to delivering exceptional healthcare services, making it an attractive destination for potential worldwide. Its distinctive competitive edge makes an irresistible destination for medical tourists by offering a unique synergy of quality medical care, world-class hospitals, cutting-edge technology, and highly skilled medical professionals. Reasonably prices without compromising on quality, making it an attractive option for international patients. A rich tapestry of history, culture, and natural beauty, providing a unique and enriching experience. Gujarat has positioned itself as a premium medical tourism hub where patients can receive exceptional care while immersing themselves in a state's vibrant culture and heritage. थोड़ा मैं गुजराती में या हिंदी में भी बोलना चाहूँगा. I can understand English, read, but can't speak it fluently. लेकिन आपके साथ मैं अपनी मदर टंग में, अपनी जुबानी में बात करूँगा तो मुझे लगता है तो वो वर्थ भी होगा. मेडिकल टूरिज्म की बात, मेडिकल ट्रैवल वैल्यू की बात हम कब से कर रहे हैं, लेकिन जितना संतोषकारक, क्योंकि दुनिया में, पूरी दुनिया के अंदर मेडिकल के क्षेत्र में हमारे जितने प्रोफेशनल्स हैं, हमारी हॉस्पिटल्स है और जितने डॉक्टर्स भी हैं, हाईली स्किल्ड और अच्छी से अच्छी सर्विस दे सके, ऐसा पूरा हमारा देश का माहौल भी है. यहाँ से बहुत सारे स्किल्ड डॉक्टर्स बाहर जाके, दुनिया में जाके अच्छे से अच्छी सर्विस दे सकते हैं. लेकिन आज भी हमारे देश के अंदर बहुत अच्छे डॉक्टर्स, हॉस्पिटल अब अवेलेबल है. 21st सेंचुरी में, 21वीं सदी में नरेंद्र मोदी साहब का जो विज़न था, वो विज़न इसलिए था कि यहाँ पर डॉक्टर, उनके एफोर्डेबिलिटी, साथ में हॉस्पिटल के जो चार्जेस लगते हैं वो भी लो है, और साथ में पूरे दुनिया के अंदर हेल्थ सेक्टर के अंदर जहाँ पर भी ट्रीटमेंट मिलता है बहुत महंगा, बहुत डिलेइंग, और उसकी वजह से यहाँ पर वेटिंग पीरियड भी ऑलमोस्ट ज़ीरो है. आपको कुछ हुआ है, हार्ट का कोई प्रॉब्लम है, किडनी का कोई प्रॉब्लम है या कोई सामान्य फीवर भी है, तो यहाँ पर तुरंत इलाज, डॉक्टर की सलाह, हॉस्पिटल सब अवेलेबल रहते हैं. तो दुनिया भर के लोगों के लिए यहाँ पर अच्छा मेडिकल फैसिलिटी हो. लेकिन वो कैसे करें? दुनिया में हमें ये मार्केटिंग भी करना है कि हमारा जो मेडिकल सेक्टर है यहाँ भारत का और ख़ास करके गुजरात का, उसको बाहर फैलाने के लिए बाहर उसको मार्केटिंग भी करना पड़ेगा. अगर आपको कोई तकलीफ़ हो तो आओ, भारत में आओ, हमारे ये हॉस्पिटल, हमारी फैसिलिटी ये है. तो एक जॉइंट एडवेंचर, मतलब कि पब्लिक और आप सब जो प्राइवेट से आए हुए सबको मिलके एक ऐसा ऑर्गेनाइजेशन बनाना पड़ेगा कि बाहर के देशों के लोगों के साथ आप इंटरेक्टिव हो, आप उनके साथ बात कर सको, आप अपनी पूरी फैसिलिटी उनको दिखा के यहाँ पर लाने के लिए एक पूरा मैकेनिज्म तैयार करना पड़ेगा. और इस दिशा में आज हमारे यहाँ 2 GCI हॉस्पिटल्स है, NABH तो है, लेकिन अब बाहर की दुनिया के साथ, बाहर के दुनिया के लोगों के साथ यहाँ पर हमें हमारा महत्व दिखाना है तो GCI से भी कनेक्ट होना पड़ेगा. NABH तो खैर हम कर ही भी रहे हैं, लेकिन बहुत सारे हॉस्पिटल आज भी अच्छे हैं. क्यों, पता नहीं क्या वजह है कि वो NABH भी नहीं कर पा रहे हैं. लेकिन अब के समय के अंदर दुनिया के साथ हमें दौड़ना है और दौड़ के सबसे आगे पहुंचना है. तो पूरी तरह से प्राइवेट हॉस्पिटल और सरकार की ओर से मैं आपको वादा करता हूं कि पूरा ये आप ऑर्गेनाइजेशन बनाइए और साथ में दुनिया भर में आप फैलिए. दुनिया भर से, अपने देश के बाकी के क्षेत्रों में से भी यहाँ पर हमारी मेडिकल फैसिलिटी के लिए अच्छे से इंतजाम हम कर सके, ऐसी हमारी कैपेबिलिटी भी है, इंफ्रास्ट्रक्चर भी है और हमारी विरासत भी है. तो मैं आप सबसे ये मौके पे एक रिक्वेस्ट करना चाहूँगा कि अगले समय के अंदर ये प्रक्रिया बहुत झड़प से हमें करनी है. आप, प्राइवेट और सरकार सब साथ में मिलके एक ऐसा इंस्टीट्यूशन बनाए कि जिसकी वजह से हम हमारे यहाँ गुजरात के अंदर ज़्यादा से ज़्यादा, भारत के अंदर जो मेडिकल टूरिज़्म की बात है, मेडिकल टूरिज़्म की बात भी गुजरात से चालू हुई थी. हमारे यह सारवा सिविल कैंपस पूरे एशिया के अंदर सबसे बड़ा कैंसर, बहुत सारी OPDs, IPDs, सर्जरी, बहुत सारा कुछ यहाँ हो रहा है. तो इसके लिए भी आप सब अपना प्रेजेंटेशन देंगे, आपकी बात भी रखेंगे, लेकिन एक यूनाइटेड होके वन हेल्थ, वन फैमिली एंड वन वर्ल्ड हमें बनाने की बात है, तब सदैव कुटुंब कम की जो हम बात करते हैं, वो बात को चरितार्थ करने के लिए हमें इस मेडिकल क्षेत्र के अंदर भी, हेल्थ के क्षेत्र के अंदर भी हम साथ मिलके काम करेंगे तो बहुत सारा गुजरात का भी फायदा है, आपका भी फायदा है और सरकार का भी फायदा है। तो इस बारे में आप सब सोचिएगा। थैंक यू वेरी मच।
Thank you so much, sir, for your powerful address and all your unwavering commitment toward the health and beneficiality of the nation. Your leadership continues to inspire us and guide us towards the healthier future for all. Thank you so much, sir, once again.
Thank you, sir. Visionary leaders never settle for just good enough. They expect and bring perfection from everyone around them. In that sense, the next speaker needs no introduction. He is the captain of our ship at UN Mehta Institute, leading us into the future, a cardiothoracic vascular surgeon par excellence. I request our Honorable Director, Dr. Chirag Doshi, sir, to say a few words. Let's welcome him.
Very good morning. Before I start my presentation, I would like to thank today's chief guest and our Honorable Cabinet Minister, Shri Rishikesh Patel Sahib, for accepting our invitations and gracing this occasion, sir, and for your wonderful, motivating and inspiring speech, sir. So thank you so much for keep motivating us. Today's guest of honor and a very energetic and dynamic Principal Secretary of Government of Gujarat, Shri Dhananjay Sahib Trivedi, Health and Family Welfare Department, sir. Thank you for coming here and joining with us today. Our Tourism Secretary, Government of Gujarat, Rajendra Kumar, sir, is here along with us. So thank you, sir, for being here. Dixit Saab is Additional Director, Medical Education and Research. Thank you, and I would like to welcome you, sir. The dignitaries from the Medicity, the directors and superintendents, I also would like to welcome them and extend my gratitude. The dignitaries who have come all the way from different countries, diplomats, high commissioners. So I truly welcome at our institute. Thank you so much for coming here and spending a valuable time with us. Then there are colleagues, like I would say we have only told them once, they are from the corporate sectors. They are the CEO, directors and representative of corporate sectors. So I really appreciate that you accepted our invitations with one call only. So thank you so much for being here. And my all fellow colleagues and UN Mehta family, Vasudev Kutumbakam, that means one earth, one family, one future. And our Honorable Prime Minister strongly believe that India has everything needed to be the hub of medical tourism. So let me just quickly brief you through a UN Mehta journey, how it has started, when it is started. So where we stand here is right now is one of the largest cardiac care centers in the world and probably the largest in the country. So UN Mehta has started his humble journey almost 4 decades prior. It has started in 1982 with a one small ICU of a 4 beds only. But with continuous dedication, commitment and obviously support of a government of Gujarat and health department, we have reached to a stage where we have a 1251 beds with 15 modular theaters and 6 cath labs. So what I want to say is what UN Mehta offers pertaining to cardiac care is under one roof. So every possible cardiac care is possible right now at our center, sir. So we have 6 different cardiac cath labs which are very highly sophisticated and equipped with most of the technology which is available in the world. We have it, and because of this cath labs and the skilled doctors, what we can produce is a almost more than 100 angiogram a day, or including pediatric procedures, electrophysiology procedures in this cath labs. These are all equipments which are available with us right now in the cath lab. These are IVOS, OCT. And as I said earlier, that we have a very high-end modular theaters where we can operate almost more than 27 open heart surgeries a day. And this is also laced with the latest technology, robotic technology. So just to give you emphasis on this robot that we have started in Western India, and so far we have done the maximum numbers in Western India, robotic cardiac surgery. This is again a very unique concept that we have with us, that is homograph valve bank. Again, we are the only institute which has a homograph valve bank in Western India, and it runs really successfully. Here also we run program which is heart and lung transplant. So far we have done more than 41 transplant with almost in-hospital success rate is 95%. And we have a dedicated ICU for transplant, which is like a 3-barrier ICU, where there is a least chances of patients getting infections. This is our very high-end ICU. We have total more than 500 beds of ICU, which is again one of the largest ICU in India, which is again equipped with most sophisticated and most technological advanced equipments, and out of which 200 beds are of paperless and totally integrated. That means we can monitor patients from remote places, their real-time monitoring, like their hemodynamics, their ventilator parameters, their drugs, that we can monitor from distance. So this is very indigenously developed by our own institute. And obviously this all been backed by the team of doctors. The team of doctors that we have, some of our doctors, they've been here for more than 2 decades, and they are very well experienced and well versed with the technology, and they produce an excellent outcome. And they not only perform simple cases, but they perform complex and more complex complicated patients. And their outcome is as good as the international standards. And with the team, what we believe is the staff, the trained cardiac staff, they are the backbone of any of the institute. The institute like this institute, which is on a very large scale, we have a tremendous team of cardiac staff with us and trained paramedical staff. And because of that, the efforts of our team members, what we can do is we can produce a n number of volumes as well as the quality results. So look at the volume. So far what we have screened or evaluated more than 3 million patients here, and out of which almost 500,000 patients got admitted at our institute. So far what we have done is we have done more than 3,200,000 cardiac procedures and 91,000 open heart surgeries. So that means, and these are just a few numbers, because 20% of our patients, they keep coming from the other states than the state of Gujarat, like a neighboring state like Maharashtra, Madhya Pradesh, or part of MP. But then having said that, so far what we have done, we have screened almost 1,058 patients. We evaluated them thoroughly. We have treated them. They are from international overseas patients, and majority of them being from the neighboring states. So in short, what we do on an everyday basis, we have a capacity, we have a perfect resources to cater more than 1,200 outdoor patients. We admitted almost more than 165 cardiac patients every day. We perform close to 100 cardiac procedures that includes coronary angiogram, complex coronary angioplasties, pediatric intervention, neonatal intervention, and electrophysiology. And we do almost close to 27 open heart surgeries, which includes complex bypass surgery, complex valvular repairs, pediatric and neonatal surgeries. And this is just a few numbers of us. So last year, having said that, we have done more than 8,000 open heart surgery. We put us on the world map. We are the one who is right now in cardiac sciences. We are leaders in the world in terms of volume and in terms of producing quality. So our work has been recognized with numbers of awards on an international and at the national level. So far we have received 87 awards, and out of which 10 are at the international platforms. And these are particularly for quality and clinical outcomes. our, like what our honorable cabinet minister just said, that we all are like NABH accredited hospital. Our hospital has been accredited since last 10 years. But just for information, I would like to share information that our hospital is the only hospital in Gujarat, including private sectors, where we got a digital NABH gold standard certifications. So that shows our commitment and dedications to produce a good quality outcome. So we always adhere to a basic principles of sciences, and we follow the protocols very rigidly. So obviously you all would be thinking that why to choose this institute over the other institute, because you've been sending your patients to the other institute or to the other countries, you know. So to answer those questions, we have a very good number of doctors which are internationally acclaimed, renowned, and highly qualified doctors, team of doctors and staff. They are not only qualified, but they are available, approachable, and accessible 24/7. They give services 24/7, 365 days in this hospital. So your patient is absolutely safe here. And this is our vision. I mean, our vision has always been to produce a quality cardiac care. And for this, our patient positive satisfaction index is always remained more than 95%. And one more thing that just I would like to highlight is for last 2 consecutive years, according to one of the recent data, the UNMICRC Heart Institute is top amongst the Western India cardiology hospital, and among 10 in India, among top 10. So obviously we all would be like, what we provide is a holistic care with an affordable price, with compassion and human touch. So you look at the price, just the cost packages. This is like, I would say, 1/10 of what the other part of the world has been offering to your patients, where they also produce the same results. We also produce almost maybe not inferior to them, and at the same time, whichever materials that been used for your patients has to be minimum standard of US FDA. We have a designated facilities within the premise. So your patients will be, not only your patients, but their family also will be treated equally with lot of comforts. So their stay would be, or their journey would be very stressless. Sorry. And this is while another added advantage of this hospital, that we have a telemedicine. So by doing this, what we can do is we can connect with your patients, even if patient is not in the hospital, away from the hospitals, or when they are back at the home, our doctors are always in touch with them 24/7 through this telemedicine applications. So they feel like their anxiety and stress level can reduce drastically when they are not in the hospital or not nearby hospital. And I'm sure that you know our numbers. We cater a lot of volumes. So that is what just Honorable Prime Minister, Cabinet Minister has just said, that the promptness, or I would say there is no delay in the treatment, or I would say no waiting time for them. The moment we receive patients, or the moment we screen them, we can call them, we can treat them, and we can send them back safely to your places. Once they reach home also, it is our responsibility. We can monitor continuously through telemedicine. So there won't be any delay in the terms of treatment. So if there are so many advantages of benefit being associated with us, so why not? We all are ready to give or provide best services to your patients. So thank you so much for your kind listening. Thank you.
Thank you so much, sir, for your insightful and informative presentation.
Speaker is as dynamic as they come. Sir is a pioneer of laparoscopic and robotic kidney transplantation with one of the largest series in the world. He established the liver transplantation program in the public sector. He is the professor and head of transplantation surgery and urology at IKDRC, the Institute of Kidney Diseases, and the Vice Chancellor of Gujarat University of Transplant Sciences. Let's give a warm welcome to Professor Pranjal Modi, sir.
At the outset, I would like to thank the Government of Gujarat and the UN Mehta Institute of Cardiology to give this opportunity to present before the audience over here. My subject is public-private partnership in strengthening the healthcare in medical tourism. So let me introduce the work which we do it first. I'm the director of the Institute of Kidney Disease and Research Center and Institute of Transplantation Sciences. The institution was established in 1981 as a 6-bedded hospital, and then it has grown now today to 1,050 bedded hospital with the 20 modular operation theaters. We have one of the largest kidney transplant program of the world, and that is the 70% are a living donor kidney transplant, 30% are a deceased donor kidney transplant. We are the pioneer in the country to establish the deceased donor organ transplant program way back in 1997 onwards. Until this time, more than 1,000 kidney transplants are done from the deceased donor, 700 liver transplant from the deceased donor. And also we have established now a living donor liver transplant program. We run one of the largest urology program. We have 3 seats per year, and now we are going to increase to 6 seats per year. Also have a nephrology, oldest nephrology program in the country, one of the oldest nephrology program. We provide dialysis to the entire state of Gujarat, covering 270 dialysis centers are having a 3 to 5 dialysis machine on each center, and we run that efficiently under the Prime Minister National Dialysis Program. So these are the few things that IKDRC is running. With the help of the then visionary Chief Minister of Gujarat and now the Prime Minister of India, Shri Narendra Bhai Modi, we could establish the sectorial university for transplantation sciences. So this is the first ever university, the Gujarat University of Transplantation Sciences, conducting the various courses related to the transplantation sciences. And with this background, I would like to go ahead with the coming subject. What's the definition of a PPP as a public-private partnerships? These are the arrangements between government and private sector entities for the purpose of providing investment in public infrastructure, community facilities, and related services. The public and private sector medical tourism related infrastructure initiatives such as health, education, transport, and communication for industry success. We have complete establishment of all the sectors, which includes the health, education, transport, and communication. This is very important part, because if this one of the 4 parameter is not available, it is very difficult to establish the tourism. What are the stakeholders which we have worked it out here? If you can see this stick diagram, there are players. Most important is patient, employers, government, and insurance carriers. There are facilitators, especially the medical value travel facilitators, and the third party aggregates who can promote the tourism. Healthcare providers, especially the hospitals like what you have seen here, the UNMICRC, Institute of Cardiology, the Institute of Kidney Disease, that is a Cancer Institute, it's Medicity campus, and there are private hospitals also, and even clinics. The travel and tourism part, airlines, hotels, travel agencies, transportation, tour operators. Public institutions like stakeholder ministries, tourism, health, external affairs, visa department, etc. And private entities like hospital associations, accreditation organizations, and business organizations. So everybody is taking part of the entire tourism process, and we are very well equipped with all those things. Coming to the accreditation standards, I think the Honorable Cabinet Minister and the Health Minister, Shri Rishikesh Patel, has also mentioned about it. We all have NABH accreditation, and few of the institutions are having Joint Commission International accreditation, as well as some other accreditations. Coming to the government initiatives, there is a Government of India's policy by 2022 is a Heal in India, Heal by India. So the Ministry of External Affairs and the Ministry of Health is promoting jointly the Heal in India and Heal by India program. So the medical tourism is easy for the patients who want to come there. The services in their country or their region is not available or is having a limited resources, because the infrastructure establishment is one of the most important issue which is now established very well in this part of the world. The hub for medical and wellness tourism globally, inviting the world to heal in India with the mandate of seva rather than earning the money out of it. So the mandate is very important. The mandate is seva. Seva means services coupled with the Atithi Devo Bhava on mission mode. So this concept is important. It's not unlike in what is happening in a western part of the world. It is not the earning out of the patient services. It is the services in a pure way. What are the scopes for medical tourism in Gujarat, especially in both public and private? If I have to see, we have a robotic surgeries available very cheaply. Robotic kidney transplantation, we are the pioneer in the world. It's not only in India, we are pioneer in the world in establishing such type of medical services. Urology, hepatobiliary surgery, cardiac surgery, cancer surgery, orthopedic surgery, etc. All these surgeries are offered with the nominal charges, and robotic surgery is now the norm in most of the part of the world. Coming to the other kind of minimally invasive surgeries like laparoscopic surgeries, living donor nephrectomy, urology, gynecological surgery, general surgery, etc. The living donor and deceased donor liver, kidney, heart, pancreas, and uterine transplantation. We are the only transplant university running all these courses. Adult and pediatric patients dialysis, spine surgery, eye surgeries, dental surgery, cancer chemotherapy, everything is available under one roof in Medicity campus or also in private hospitals. Interventional cardiology, intervention radiology are already you have heard about it with the previous speaker. For gynecology and infertility sector, also we are one of the best in vitro fertilization units and the obstetrics and gynecology care for those patients who have a poor obstetric cares in the other part of the world. Diagnostic and research laboratories are plenty. Modern immunology, pathology, biochemistry lab, including mass spectroscopy for drug assay and diagnosis of a rare diseases, all facilities are available under one roof. Blood banks, and there are more than one blood bank in a campus. Almost every institution is having their own blood bank. Genetic laboratory with next generation sequencing is available. Radiology part like ultrasound, CT, MRI, and interventional radiology is also available. Radionuclide studies like PET CT, PET MRI, etc. So as far as diagnosis facilities are available, everything is available in state of Gujarat, both in public and private sectors. If you see the approximate cost of surgery for foreigners, this is the important part. Just I have calculated in for few surgeries only, like living donor liver transplantation in a Western world would cost about 90,000 to 100,000 US dollars. It is available in 15,000 US dollars in my center. Laparoscopic living donor nephrectomy and robotic kidney transplant, it's 5 times more cost in a Western world. It is available only in 8,000 US dollars. Like open kidney transplant is only 6,000 US dollar. Robotic surgery for prostate, kidney cancer, and other cancer maybe 5,000 US dollars. Robotic assisted living donor hepatectomy and liver transplantation just 18,000 US dollar. The cost in the Western world is more than 150,000 US dollars. Coming to the medical education, we have a National Medical Commission and the National Board of Examination. These are the two medical boards in India, and having a universities. We can offer the with the help of the or intervention of the NMC and NBE, we can offer the graduation, post-graduation, super specialty fellowships and technical courses, especially in dialysis and transplantation program. The tourism in education and research is possible with the collaboration with the foreign university students for fellowships, technical courses and paramedical courses, collaboration for medical education, and conference and workshop participations. This is our web page. One can go through it and we can communicate it further. In summary, Medicity at Ahmedabad and several private organizations in Gujarat are having a great diagnostic and therapeutic facilities. In comparison to Europe and United States, overall cost of investigations and treatment is 5 times and 2 times lower in public and private hospitals respectively. Highly experts medical paramedical professions. There is no waiting list. International and domestic airports are available, so the easy to travel, and very receptive culture for the non-resident Indians and also for the foreigners. Thank you very much. We welcome you for the transplantation conference, which is going to come on 7th and 9th of February. Thank you so much.
Thank you so much, Pranjal sir, for your thoughtful address.
The crusade against cancer is a relentless one, and who better to speak about it than the director of Gujarat Cancer and Research Institute, under whose leadership the institution has now become the premier cancer institute in the country. Please welcome Dr. Shashank Pandya sir, director of GCRI. Sir will talk about why patients choose us.
Good morning to everyone. Representative of different countries, respected Dhananjay Dwivedi sir, Principal Secretary, Health and Family Welfare, Government of Gujarat, Tourism Secretary Sri Rajendra Kumar, IAS, Head of different institute. I am Dr. Shashank Pandya, Director of the Gujarat Cancer and Research Institute. Next. Can I see how this thing? Okay. GCRI is established in 1972 as a premier cancer care center in India. This is the first successful public-private partnership model of the Gujarat state. It is jointly managed by Government of Gujarat and Gujarat Cancer Society, making a ray of hope for cancer patients across the nation. Recognized as a center of excellence and state cancer institute for its holistic approach to cancer care, GCRI integrates advanced treatment modalities, research and education. If we see the history of GCRI, fundraising program in the form of Veshbhusha done at Kama Hotel, Kanpur, Ahmedabad in 1960. Then Governor of Gujarat, Sri Mehdi Nawab Jung, gave an idea to the members of Inaugural Club of Ahmedabad that we should form Gujarat Cancer Society. Under his leadership, Gujarat Cancer Society established in April 1961. Then they have started construction of the Cancer Hospital, and in 1964, MP Shah Trust London donated 55,000 sterling pound, and journey of Cancer Hospital started with 40 bed capacity. In 1972, through tripartite agreement between Government of Gujarat, Gujarat Cancer Society and newly formed body called GCRI, it came into existence from 1st February 1972. Looking to its development and growth, Government of India, Ministry of Health and Family Welfare recognized this institute as Regional Cancer Center in 1981 and as a State Cancer Institute in 2015. Our mission is to provide equitable, affordable and state-of-the-art cancer treatment on all sections of the society. Our vision is a cancer-free society achieved through comprehensive care, innovative research and widespread education. GCRI aims to be a leader in cancer treatment and prevention. This is data of last year. We have treated approximately 25,956 patients in year 2024. We are treating patients, approximately 65% patients are from our state and 35% of patients are coming from other states, and we have treated 5 patients, internal patients, 6 patients, internal patients also. You can see patients are coming approximately 3,000 kilometers away from the Gujarat, from Meghalaya, the Arunachal, Tripura. We are treating patients from these states also. We are providing comprehensive cancer care under one roof. We have different departments in the form of surgical oncology, medical and pediatric oncology with bone marrow transplant unit, gynec onco, radiation onco, palliative medicine, anesthesiology, radiodiagnosis, nuclear medicine, oncopatho, microbiology, community oncology, cancer biology with research wing and physiotherapy department also. This is our infrastructure. Our general ward also are high-end and all are central ESC. We have 128 slice CT scan machine. We have 19 high-end modular OT. We have next generation sequencing machine. 3 Tesla MRI machines also there, and advanced ICU setup is also there in our institute. Our bed capacity is 1,000 bed. Our radiotherapy department is equipped with high-end equipment in the form of linear accelerator true beam, tomotherapy, CT simulator, brachytherapy, and cyberknife also. This is the only government institute in the country who have cyberknife facility. We have collaboration with UICC, ICMR, NCDIR. Even we are member of International Association for Hospice and Palliative Care, and along with them, we are doing lot of work for palliative care also. We are member of, and we are doing collaborative program with IARC, International Agency for Research on Cancer, and WHO also. We never compromise for quality. Our institute is NABS as per 5th edition. Our all labs are NABL accredited. Our ethics committee is first in the state which is NABS accredited. We have gold quality certification for excellence in PMJ, and GCRI is included in top 50 medical institutes in NIF ranking that is given by Ministry of Education, Government of India. This is routine quality assurance certificate which is required as per norms of the NABL. In Vic magazine has ranked GCRI as 9th best hospitals in oncology category across the India and 2nd best in Western region. We all know that cancer is leading cause of death worldwide after cardiac. Approximately 20 million new cases and around 9.7 million deaths occur worldwide per year. Access to quality cancer care remains a significant challenge in many regions, specifically in low and middle income countries. Financial barriers often prevent timely diagnosis and effective treatment. Why choose GCRI for medical tourism? Because we provide affordable world-class treatment significantly lower than global rates. Multidisciplinary team of experienced oncologists and researchers are available. Advanced technologies in the form of cyberknife, high-end linear accelerator, 3T MRI, PET-CT, next generation sequencing, minimally invasive surgery, high-pack, organ preservative surgery also done at our institute, and we are giving personalized patient care also. Cancer treatment is personalized. Each case requires a detailed workup including staging and molecular diagnosis. Once staging workup is done, according to the stage, we have to decide the patient treatment, and then we can give financial package for the treatment. So you have to do mail to on our medical tourism at gcrindia.org. Our expert team, you have to send medical records, reports and case history on this mail. Our expert team will carefully evaluate your case, and you will receive a comprehensive treatment plan with an estimated cost tailored to your specific needs. For all types of cancer, treatment cost will be very less as compared to developed nations. We are transforming lives. This is success story of our cancer cure patients. All are more than 10-year cancer survivor patients. This is our website and email ID for future contact. Thank you.
Thank you so much, sir, for your informative presentation. Now, we move forward to the next segment of today's event, the presentations from the esteemed directors and the representative from some of the leading corporate hospitals across Ahmedabad. This presentation will shed light on the strides made in the healthcare innovation, the challenges faced, and the future initiative that will push the boundaries of the healthcare. I would like to welcome the representative from the Marengo Sims Hospital, Ms. Pratima Parmar, who is going to talk on medical tourism, challenges and roadblock. Please, ma'am.
Good morning, everyone. It's an honor to be a part of esteemed global health platform. I am Dr. Pratima Parmar from Maringo Sims Hospital. Today, I would like to tell about a journey of Sims Hospital from humble beginning to where we stand today as leaders in healthcare with a strong commitment and excellence. Could we please have video?
सन 2010 में गुजरात में एक सपना साकार हुआ जब कुछ दूरदर्शी डॉक्टरों ने एक मिशन के साथ सिम्स केयर इंस्टीट्यूट ऑफ मेडिकल साइंस की स्थापना की। सपना था गुजरात के लोगों को दुनिया की सबसे बेहतरीन स्वास्थ्य सेवा देना। डॉक्टर केयूर परीख, डॉक्टर मिलन जग, डॉक्टर हेमांग बक्सी और डॉक्टर उर्मिल शाह, डॉक्टर अनिश चंद्राना, डॉक्टर अजय नाइक, डॉक्टर सत्य गुप्ता, डॉक्टर धीरेन शाह जैसे प्रतिष्ठित डॉक्टरों के विजन के साथ गुजरात को एक ऐसा अस्पताल मिला जो स्वास्थ्य सेवाओं में नए मापदंड स्थापित करने के लिए तैयार था। 2010 में शुरू हुआ एक छोटा सा मिशन जो आज गुजरात के स्वास्थ्य क्षेत्र में एक मिसाल बन चुका है। सिम्स ने अपने शुरुआती वर्षों में ही गुजरात में हेल्थ केयर उत्कृष्टता की पहचान बना ली। यहाँ के डॉक्टरों और स्टाफ का एक ही मिशन था, क्लिनिकल एक्सीलेंस, और मरीजों की देखभाल को एक नए स्तर पर ले जाना। 2016 में सिम्स ने गुजरात में एक ऐतिहासिक उपलब्धि हासिल की जब राज्य का पहला सफल हार्ट ट्रांसप्लांट किया गया। ये सिर्फ गुजरात के लिए ही नहीं बल्कि हमारे देश के स्वास्थ्य क्षेत्र के लिए भी एक नई शुरुआत थी। सिम्स ने उन्नत उपचार में अग्रणी भूमिका निभाते हुए ट्रांस कैथेटर आर्टिक वाल्व रिप्लेसमेंट जैसी तकनीक को अपनाया जो हृदय और थैलेसीमिया जैसी बीमारियों के इलाज में एक नई रोशनी लेकर आई। सिम्स मल्टी स्पेशलिटी हॉस्पिटल को जॉइंट कमीशन इंटरनेशनल द्वारा गुणवत्ता मानकों के उच्चतम स्तर के लिए मान्यता प्राप्त हुई और हमने लगातार 3 वर्षों तक इस प्रतिष्ठित मान्यता को बनाए रखा है। 2018 में सिम्स को इंटरनेशनल हेल्थ केयर अवार्ड्स में गुजरात का सबसे बेहतरीन मल्टी स्पेशलिटी अस्पताल का पुरस्कार मिला। ये सम्मान सिर्फ सिम्स के डॉक्टरों का नहीं बल्कि हर उस मरीज का था जिसने अपने इलाज के लिए हम पर भरोसा किया। टाइम्स हेल्थ आइकन अवार्ड 2018 में सिम्स ने ऑन्कोलॉजी और क्रिटिकल केयर में भी अपना श्रेष्ठ दर्जा बनाया। 2020 में मैरिंगो सिम्स ने एक और महत्वपूर्ण कदम उठाया जब वो और मैरिंगो एशिया एक साथ जुड़ गए। इन दोनों की समान विचारधारा, एक जैसे दृष्टिकोण और पेशेंट फर्स्ट की नीति से मैरिंगो एशिया ने सिम्स को नई ऊंचाइयों और व्यापक क्षितिज की ओर अग्रसर किया, जिससे ये न केवल गुजरात के मरीजों के लिए बल्कि वैश्विक मरीजों के लिए भी अधिक सुलभ और प्रभावी हो गया। मैरिंगो एशिया हॉस्पिटल्स ने सिर्फ गुजरात में ही नहीं बल्कि भारत में भी हेल्थ केयर को नए आयाम पर ले जाना शुरू किया। हमने कार्डियक फोकस्ड अस्पताल से मल्टी स्पेशलिटी अस्पताल बनने की दिशा में कदम बढ़ाते हुए विभिन्न विशेषज्ञताओं में सेंटर ऑफ एक्सीलेंस की शुरुआत की है, जिनमें शामिल है कार्डियक साइंस, ऑन्को साइंस, न्यूरो साइंस, ऑर्थो साइंस, एक्सीडेंट और इमरजेंसी साइंस, ट्रांसप्लांट प्रोग्राम। इन केंद्रों के माध्यम से हम स्वास्थ्य सेवाओं में उच्चतम गुणवत्ता और विशेष देखभाल प्रदान करने के लिए प्रतिबद्ध हैं। डॉक्टर राजीव सिंघल के नेतृत्व में हमने पेशेंट फर्स्ट दृष्टिकोण को न सिर्फ अपनाया बल्कि नए क्लिनिकल उपलब्धियों की ऊंचाइयों को भी छुआ है। इनमें एशिया का पहला ब्लडलेस हार्ट ट्रांसप्लांट और गुजरात का पहला बायलेटरल लंग ट्रांसप्लांट शामिल है। इसके साथ ही हमें न्यूज वीक द्वारा वर्ल्ड के सर्वश्रेष्ठ अस्पतालों में से एक के रूप में भी सम्मानित किया गया है। आने वाले 25 साल मैरिंगो एशिया हॉस्पिटल के लिए और भी बड़े होंगे। हमारा सपना है कि हर मरीज तक हेल्थ केयर का बेहतरीन रूप पहुंचे और नई तकनीकों और नवाचारों के जरिए हम नए मुकाम छुएं। आज हम मैरिंगो एशिया हॉस्पिटल के 4 साल के सफर का जश्न मना रहे हैं। ये यात्रा सिर्फ एक अस्पताल की नहीं बल्कि उन सभी डॉक्टरों, नर्सों, स्टाफ और मरीजों की है जिन्होंने हमेशा मैरिंगो सिम्स पर अपना भरोसा बनाए रखा है। मैरिंगो सिम्स ने हॉस्पिटल को एक नई दिशा दी है। मैरिंगो सिम्स हॉस्पिटल की एक नई दिशा है।
Thank you. So I am representing our hospital, Maringo Sims Hospital, Ahmedabad. So we have hospital stands as a global leader in organ transplantation, excellent in heart, lung, liver, kidney, and bone marrow transplantation. As we have known that we have done our first blood-led heart transplantation last year. We have our in-house blood bank within hospital premises for the smoother and the better patient facilities and the coordinations. We have done more than 10 international countries tie-up for the international patient for the care and treatment. For the patient care from the each group of patients from pediatric to old age, we have served all type of treatment in our hospital. Hospital brings international patients across the globe. We assure you that smallest of your need will be looked after the almost care. We at Maringo Sims Hospital believe in bringing the gaps between customs, language and cuisine to give our overseas patients to comfort and being at home. Thank you. Jai Hind.
Thank you so much for sharing your thoughts.
Now we would like to welcome Dr. Chaitsi Mehta ma'am from Zydus Hospital to talk on driving growth in medical tourism. Please ma'am.
If you want to switch the PPT over there.
ગુડ મોર્નિંગ એવરીવન, ગુડ નૂન. આજે આપ સૌની સામે ઉપસ્થિત થવું એ મારા માટે ઓનરની વાત છે. આપ સૌનો ખૂબ આભાર કે આપે મને આ મોકો આપ્યો. ખાસ કરીને ઓનરેબલ હેલ્થ મિનિસ્ટર ચિરાગ દોશી સર, ડૉક્ટર Joshi here, and everybody at the team of IKDRC, UN Mehta and organizing committee. Thank you, Mukta madam. It is a pleasure to represent Zydus Hospital, which stands as an icon of clinical excellence and hospitality together. Let's walk through quickly for the next 5 minutes of what Zydus has to offer to its international patients. So driving growth in medical tourism. કોઈ પણ વસ્તુનો ગ્રોથ એ એક કોમ્બિનેશન હોય છે વ્યક્તિગત મુદ્દાઓ અને ક્લિનિકલ કેરના. સો આપણે એ લોકોને પોતાના ઘર જેવું જેટલું ફીલ કરાવીએ એટલા જ વધારે એ લોકો માટે આપણે એક સારું ડેસ્ટિનેશન બની શકીએ. માત્ર ક્લિનિકલ કેર નહીં પણ ખરા અર્થમાં કેર આપીએ. એમાં ક્લિનિકલ પાર્ટ જેટલો અગત્યનો છે એટલો જ કેર ભાગ અગત્યનો છે. So, Zydus is currently catering to 50 international IP patients on average. અમારી પાસે ઇન્ટરનેશનલ પેશન્ટ્સ માટે એક ડેડિકેટેડ વોર્ડ પણ છે અને આપણે ત્યાં આજે 50નો આંકડો છે માત્ર ઇન પેશન્ટનો છે. વી હેવ નોટ કન્સિડર્ડ ધ કાઉન્ટ ઓફ ધી ટેલિકન્સલ્ટ્સ, e-consults and other outpatient and health checkups. They are separate. Currently the countries which are coming very frequently are Kenya, Tanzania, Uganda, Madagascar, and the rest of the countries. Mostly we are catering to Middle East, Africa, and US, UK. So when we are speaking of international patients, let us be clear that we are talking about two types of patients which we are referring to. One is the international from different countries and one with the non-resident Indians. I think that diaspora in itself is so huge that it should be considered as well. So Western nations, both the natives as well as the non-resident Indians are coming. Scope of services at Zydus are everything except inpatient psychiatric services. We are offering entire plan right from infertility, cardiology, gynec, hepatobiliary. It's a quaternary care center, and we are also the center for a lot of second and tertiary patients, as in the patients which have been treated outside in different hospitals in different countries, and after taking the primary treatment there, they get shifted to Zydus Hospital. So we have ongoing organ transplant program and a very successful robotic program. Different scope of services along with the clinical care of 21 specialities and super specialities. We also cater to the investigations and all diagnosis in-house, including a blood bank, and anybody who runs organ transplant program knows how essential transfusion medicine is at its core. There's an infrastructural excellence to the building, as in it's a huge spread across 7.5 lakh square feet of carpet area. It has different organ-specific ICUs. I think that is the way to go. આવનાર વર્ષોમાં આપણે એ જોવાના છીએ કે દરેક ઓર્ગન અને દરેક સ્પેશિયાલિટીને એક એવું શિખર મળવાનું છે કે હોલિસ્ટિક કેર વિલ બી રાઇઝિંગ એઝ મચ એઝ કોર્નર્ડ કેર. So we have a separate dedicated wing for women and female patients, which is called Tulip and Orchid. So coming back to the driving growth of international tourism, Gujarat has to be positioned, and we are very lucky and fortunate that so many dignitaries and government officials are present here, so that we can have this conversation that Gujarat as a state has everything there is to offer on the entire paradigm. And coming to its connectivity, if we crack the code of two things, that is how to position ourselves, how to make the process smooth, and how to get better connectivity, I'm sure that nothing can beat us, because our doctors and our care packages are excellently affordable and very, very niche in all areas. So the strategic positioning goals will be to enhance global awareness, to make as many flights as easily accessible to every country, to have a targeted outreach sector, and to leverage our success stories, because Gujarat is in itself doing every work which is being done in any other metro in the country. Nonetheless, if we see at the national level, the number of patients coming are much less compared to the services that we are offering. One of the reasons is that the perception of connectivity still is going of all the Middle Eastern and the Eastern European countries towards Northern India, that is Delhi, and of East Africa towards Southern India, that is Chennai. So we should have regular government tie-ups and collaborative meetings with different countries on very official basis. So patient-friendly policies would go a long way with having connectivity, streamlined medical visa process, and easy and welcoming entry at the airport. So there's a saying in Gujarati, there's a term which is Ochi Mathakut. So there was a survey which was done for the qualities that people look in their life partners, and surprisingly less people were inclined towards making them more happier, and more were inclined towards having less hassle in life. So if we are looking for such qualities in our life partner, clearly we are looking for the same when it comes to choosing someone to take care of us, which is that the easier and the smoother we make the process, the more welcoming we make the process, the more people we will have in this idea of Vasudhaiva Kutumbakam. Also, Gujarat, like our country, is having different alternative medicines also to offer. So anybody who is coming, and ancillary services as well. So anybody who is coming for any surgery, for instance, has excellent physiotherapy, physical therapy, and other different holistic care modules as well to support them. So in Zydus, we are having the same services which are in quaternary care. We are a leading center for robotic surgery. We have different packages starting from $4,000 for robotic surgery in benign and onco, and every thoracic, gastro, pelvic, and toes in robotic surgery, and every organ transplant is being done currently. I would once again like to thank everybody who has been a wonderful audience to hear me out patiently. Ms. Vallari Bakshi is here to join us for who is taking care of international relation. And we would welcome anybody who is wishing to come to Zydus or wishing to have any word with us related to Zydus Hospital anytime. Once again, thank you everybody. Thank you.
Thank you, Dr. Mehta, for sharing your expertise with us today. Your insights were truly invaluable.
Now we are honored to welcome Dr. Parth Desai sir from KD Hospitals to present on the topic of medical tourism, balancing private and public sector interest. Please, sir.
Good afternoon. It's an absolute honor and privilege to stand amongst the august audience and present on the topic of balancing public and private interest in medical tourism, and also present about the insights of our hospital, which is KD Hospital. At the outset, I would like to thank Principal Secretary Sir Shri Dhananjay Bhai Dwivedi, Shri Rajendra Bhai, Shri Chirag Bhai Doshi, our own Health Minister, IIPHG, Government of Gujarat, and the Medicity, who has organized a wonderful gathering, and a huge round of applause for kind of making this Gujarat as a center for medical tourism and inviting all the stakeholders, which is the government as well as private organizations, to showcase the medical prowess which is there in this state. So, I represent Kusum Dheerajlal Hospital, which is a 300-bedded multi-speciality unit in Ahmedabad. It's run by a charitable institute, Sri Harihar Maharaj Charitable Trust, and hence the vision also goes accordingly is how do we ensure well-being, which is as a commitment to and live in humanity, and with a mission of having affordable, accessible, available and safe and efficacious, professional and ethical comprehensive healthcare through state-of-the-art facilities. So, in a multi-speciality hospital, the scope of services range for all the scope that can be possible in a multi-speciality hospital. But we run some niche programs also along with that. So, one of the niche program that we run is transplant services. In that we do liver, heart, lung, cornea transplants and kidney transplants as well. So at KD Hospital we have done one of the highest number of lung transplants for this state, and along with this our liver transplant program is also kind of a program where the entire state and nearby state people come to the hospital for that program, and for kidney and cornea as well. So along with having a humane approach, we see to it that all the best facilities which can be available at the current time is available at the hospital at an affordable rate for the community as well as for any people coming from the country as well as outside of the country. So Da Vinci is one of the robot which is there in our hospital, and we do all kinds of robotic procedures for oncology, urology, general surgeries, bariatric surgeries, and all the surgeries as well. Even our ophthalm department is one of the highlight in our hospital as well. So a machine called as Visumax, which is kind of a lenticule based surgery for vision correction, is also there, which is one of the best currently globally as well. We emphasize quite a lot on training our own employees and training of nursing physiotherapists across different colleges of the state as well. So this is one of the state-of-the-art simulation academy that is there inside the hospital itself, which has AR, VR based training modules as well as high fidelity mannequins. So this can be again an approach or a collaboration which we can seek overseas as well for the training of doctors, nursing, paramedics, because training paramedics is also a huge challenge, not just in India but elsewhere as well, and this can become one of the regional centers for the training. So along with affordably and high-end services, obviously the focus on quality of care, which includes clinical as well as non-clinical care, we take quite an emphasis on that. So the journey of the hospital started in 2018, and since then itself the quality was in our minds, and we have kind of all the NABH accreditations possible for an hospital, which includes for lab, for emergency services, for nursing services, the entire hospital, blood bank, and even an international accreditation, which is an American accreditation in 2022. We were the first hospital in the country to have NABH digital accreditation as well, and recently we were recognized by Indian Medical Association for championing the cause of antimicrobial resistance, and again this was the first hospital of the country to be surveillance for this cause. So our journey with international patients again had started right since the inception, and we get patients from East African countries, even West African countries like Ghana as well, and from Middle East countries, from Mauritius, and even from Iraq. Those countries we get regular kind of patients, and we have an dedicated international department who actually caters to all the needs of an international patient, right from addressing to the medical query till the visa formalities, the estimate part, the logistic part, right from their boarding of the flight from their home country till they are getting discharged at our hospital. The department of international patient is led by Mr. Himanshu, and he is also present in this gathering, so even after the session is over, you will be able to interact with him for any of the queries that you will be having. The views on my topic which was given, that how do we balance private and public sector interest in medical tourism, is we heard about Center of Excellence which government of Gujarat is running in this state, which becomes kind of a medicity at this place. Along with that, AIMS Rajkot is one of the leading centers of government, as well as medical colleges at Baroda, Surat becomes regional centers of excellence for their own respective fields. Along with that, we have great private and charitable institutes in the state which have their own niche and center of excellence programs, which are being run across different hospitals of Ahmedabad, Rajkot, Surat, Baroda. So it's not just a city, Ahmedabad, which is kind of a prominent, but at least 4 major cities of Gujarat have their own centers of excellence, which actually makes this state very conducive for medical tourism, and we will be able to cater patients across the globe. Interestingly, the doctors that we see in USA, in UK, in Australia, Canada, many of them are of Indian origin and specifically of Gujarati origin, and specifically in the college that we are sitting, which is BJ Medical College. So this becomes cradle of medical professionals actually for the globe, and you see right at the top of the positions the doctors in Cleveland, Mayo, and Sloan Kettering. All these institutes will have doctors from BJ Medical College, and since this is kind of an heart institute for the entire state and the country, we are also blessed with the medical professionals who have quality skills and medical ethics in place. Along with that, how do we build a common infra for the medical patients who are coming into our country is of utmost importance. So there is a deliberations among the institutes of private as well as public that we should be having kind of a shared resources of accommodation and infra, which caters to the needs of patients coming from other countries, which includes their food needs, lodging needs, translator needs, all those things. And if there no hospital will be able to afford the individual such setups, we all agree to that. But a common resource can be shared by all the hospitals, including private and government. It can make a huge difference to this sector. There are centers of excellence which are recognized in government as well as private hospitals. Along with a common portal facility, if developed, all the queries come to that, and we all kind of in hospitals collaborate with each other for the strength that we have, so that we can cater to the best healthcare needs for any patient coming out of the state, out of the country. And just a suggestion that if we can build up standards for accrediting hospitals who actually meet standards for treating patients outside the country. So those standards can be, are we able to accommodate, are we having trained staff for the legal requirements for visa process, or maybe train them? Are we having infra which caters to these patients? Are we having redressal mechanism for legal as well as grievance for these patients? So such standards can be built, and the hospitals who actually are serious into medical value travel can get certified or accredited under this program, and it can be listed on Gujarat government website or Government of India portal, etc. So that there is a kind of a trust which we build across the globe, and patients from different countries can easily, relaxedly, stress-free come to our state for getting their medical needs. For our hospital, training also becomes an important part. So currently we run programs for Indian doctors as well, and international doctors and paramedic staff as well into our hospital, and we run a college as well which houses nursing, physiotherapy, optometry and all the paramedic courses. So we get a lot of international people for internships and fellowship programs. So that's again an avenue that we are very keen on partnering globally across different countries. Research becomes an important part. So again, a multicentric research across maybe multi-country researches also we would be more interested to participate in. These are some of the recent awards that we have got in our journey. That is for Ophthal, that is for orthopedics, that is for visit to different countries, etc., etc. So thank you, thanks a lot, and again I would thank for giving me an opportunity to showcase our hospital and our state for medical tourism. Thank you, thanks a lot.
Thank you, Dr. Desai, for your time. Your presentation was very informative and engaging.
Now we would like to welcome Mr. Neeraj Lal from Apollo Hospital International. Sir is going to present on Ahmedabad, rise as a preferred destination for quality healthcare and affordable medical services. Please, sir.
Very good afternoon. I just want to start from where Parth has. There is a accreditation on medical value travel. I'm a part of International Society for Quality in Healthcare. So Quality in Accreditation Institute have launched a standard on MVT. So they check about different things which we are doing in the hospital in order to attract medical tourism. Very good afternoon. Thank you so much, Dr. Chirag Doshi and Dr. Mukta, for asking us to come here and showcase our medical facilities. And thank you, Sir, Principal Secretary and the Tourism Secretary. We'll be also sharing some of those things with which we want to have in the state of Gujarat to attract. As of now, Apollo, attract maximum patients in the term of medical tourism. More than 60 patients per month come as an indoor basis, and more than 200 patients coming for various outpatient treatment. We run country biggest pro health checkup program. So we do around 6,000 health checkup per year. So this is one of the most green facility in the state. We have a 10-acre campus. This hospital was started by our founder, chairman, Dr. Pratap C. Reddy in 1983. So we are available north, east, west part of the country. I'll just share one example. There was one patient coming from Gulf, 2-year-old child, wanting for a liver transplant. I was talking 3 months back. So they were supposed to fly to Apollo Hospital, Jubilee Hills in Hyderabad. Since Ahmedabad, Apollo managed the Sardar Vallabhbhai Patel Airport, they got some medical problem while they were on the flight. They landed up in here Ahmedabad, but the child was not fit for transplant, where the mother was supposed to give a liver. So we make that patient stable for 2 months, and 1 week back the patient is fine and flying back to that part of the country. So these are the things which is stories which we keep on doing. So we are the first JCI accredited hospital in the state. 3 times has been accredited by JCI. Our campus is green campus, 10-acre campus. We have around 300 plus beds, and we have, as all other hospital, we have a latest medical technology for treatment. These are the various Apollo Center of Excellence. It include from Heart Institute, spine surgery, gastro, oncology, and various other specialties. Apart from, if you are giving a good medical tourism services, I think most important thing is digital medical records. So our 85% of the records are digitally oriented. Every month, over 300 international queries come in the Apollo platform. Apollo Ahmedabad got a small share of that because of the various reason. Mumbai, Delhi, and Chennai got the maximum share. So I think if we have graduated from the manual record to the digital record, it include both OPD and IPD. We got the highest NPS scores in the country, and we got 100% in-room admission. I think this is most important part in order to attract medical tourism patient in the term of fire safety, medical safety, ER codes, surgical safety, and so on. Regarding this, these are the various awards which we have got time to time. So we have introduced Western India's first touchless, seamless, and matchless rooms. It has been seen, 30% of time staff nurse go to a patient room for a small cause which she's not required. So these are the room which is automated. Once the patient speaks, like put the AC on, put the music on, and all those things happening in these rooms, we say a crown wing. So these are the visit of various global leader which have visited. First photograph represent, he is a prime minister, he's a health minister from Indonesia. We have visitor from Kenya, Tanzania, and Mombasa. These are the few things which has come in the various press dailies. There was one Chinese worker who's working in one of the cities of Gujarat. They got a heart attack. They came to our hospital. She cannot able to communicate with our doctors and not our staff nurse. It is very, very difficult to treat this patient. So we are using the application device what we have, and this application is helping us to convert his language, and the treatment happen. And he was very, very happy after treatment. These are the various technologies what we have. We have Da Vinci XI robotic surgeries, knee replacement surgery without physiotherapy. We have Azurion cath lab. We have class 100 modular OT. And we do our hospital is the state's biggest bone marrow transplant. Our 50% patient coming in medical tourism is from bone marrow transplant. We do on the average 4 to 5 bone marrow transplant per month. So apart from medical tourism, we also do capacity building program. So we have patients, we have doctors and the students coming from different part of the world. So this patient, first picture is from Kenya, robotic prosthetic surgery. Second, Dr. Vishkarma did cochlear implant surgery, a girl of 4-year Kate from Kenya. There is a Justice Philomena from Kenya. She visited the hospital. Dr. Somej Desai on a Fatima, he did an epilepsy surgery, and various people keep on visiting our hospital time to time. So there's a Ruth Vanchuko from Kenya. Dr. General Velu Nair did a BMT on her. Bilateral knee replacement surgery done on these patients. This was a photograph which I was talking about, donor Iraq, which with a mother has given a liver to a child, baby 2-year-old. So we are Apollo. Welcome to Apollo, where precision meets innovation. Thank you very much.
That was thought-provoking. Thank you, Mr. Neeraj. We are grateful for your contribution to the event.
Now we would like to welcome Dr. Paritosh Joshi sir from Shelby Hospital to present on the topic Healthcare Without Limits, Global Solution for Tomorrow. Please sir. Instead of Dr. Paritosh Joshi, Dr. Parimal Patel is going to present on behalf of Shelby Hospital. Thank you, sir.
Thank you, madam. I'm not a doctor, just to clarify that. Thank you, dignitaries, for inviting. I thank Government of Gujarat, IKDRC, the people who are backbone or bringing the star doctors is this place of the country. Let's applaud for them because they are the place where the stars are born. So this credit goes to the institute where they have built a nation while promoting tourism became later, but promoting an every organ speciality has started from this place. So honor to all those dignitaries who are there present today and also those who are not there today, but credit goes to them. I represent Shelby Hospital as a cluster head. Being Shelby started its journey in 1994 with 6 beds, today expanding more than 2,000 beds. So what are the global challenges that people have today in their own countries? Inequitable access to health, long waiting list, high treatment cost, and limited access to specialized care. Now, India is a country where if you say digital, every tea vendor has a mobile and has an access, and we can provide the access of medical care irrelevant any part of the globe. COVID demonstrated that we can beat any obstacles, and same is here we are trying to say from this podium that yes, we are the country, we can do if we deserve what has to be done as a unite nation and unity of all healthcare providers. The preferred destination for NRI healthcare, they are very peculiar NRIs and NRGs. They take insurance here also. They stay in London, they take Indian insurance. They come back, use it, and go back. So this is a very typical Gujarati mindset because Mare Shu ne Maru Shu, this is a very peculiar way of looking at it. So they have balanced both ways. So the affordable cost they can manage, highly quality medical infrastructure that we have, and presence of a skilled medical professional. Again, I said, started with this institute and cultural and linguistic familiarity that they have. This is especially for NRIs and NRGs. The preferred destination for healthcare, Shelby started in 1994 with experience of 3 decades and having presence in 16 countries. High quality medical infrastructure at par with global standards in terms of technology, infrastructure, and care. Expertise of end-to-end medical tourism, start from his place where he is to be traveling, we pick up from his home and drop at his home. So it is end-to-end connectivity that he doesn't have to see a hassle anywhere in between. If you drop Shelby, you have been taken care of it. More than 90,000 patients avail treatment at Shelby Hospital till now. So that is a figure that in India, if we have to talk in western part of the world, in 94 onwards, with just 6 beds of a nursing home, today with more than 700 beds in Ahmedabad, we are operating. And those are the numbers that we started in 1994 till date, that this many patients avail various services at Shelby Group of Hospital. Why attractive destination for global healthcare? Because we are the competitive rates, state-of-the-art medical facilities. What you see in Europe, US, UK, you can see the same equipments here in Ahmedabad itself. Wide range of specialty treatments available and minimum waiting time. So if you just buzz it that I want X treatment, 10-15 hospitals are available with those numbers and easy access to all. Overcoming the global challenge, like we have long waiting list in other countries, access of specialized care. I got a call few days back, one person in US had a bad injury of a shoulder. He was talking to me. There was a waiting list of MRI of 4 months, he said. and he wanted a MRI urgently, and the cost of that MRI in US was 6,000 US dollar. I said in 6,000 Indian rupees you can do an MRI here, you add your travel costs, you go back in 72 hours. That's it where India stands. And we break that cultural and language barriers, because in Gujarat, because we are the place of entrepreneurs. So this is a place where everything can be possible if we deserve it, whichever way. Gujaratis find their own ways. Expanding our quality healthcare globally, we have started telemedicine and remote consultations, medical tourism facilitation, cross-border healthcare collaborations, health insurance and financing solutions. Many of people, they don't have insurance here, but we have 22 insurance companies tied up globally for international tourism. They bring in with that own insurance and we operate over here. Increase access to specialized care is the specialty that I focus here, reducing waiting time, quick access, and competitive treatment cost, and improve health outcomes. Last but not the least, patient traveling. This is my request to Government of Gujarat and the Government of India. Patient traveling on a visitor visa for some reasons, if he get ill, they have to go or obtain a medical visa. After that only they could be admitted, and that's the area where if somebody can work out some easy options for them in case of criticality, could be a savior for them, and the hassle-free treatment could be taken it over. I thank from the dais all the dignitaries, the Commissioner sir, the Principal Secretary sir, Honorable Health Minister, and not only the last Dr. Chirag Doshi and his team to invite me on such a platform. I see Dr. Rakesh Shah also over here, but I thank you from the bottom of the heart that please be open, and for the discussions, if at all it happens, we will be happy to serve you. Thank you very much.
Thank you, Mr. Parimal. That was a great talk.
Now we are honored to welcome Mr. Hemant Bhatnagar sir from Narayana Multi-Speciality Hospital. Sir would be presenting on the topic of enhancing global trust, the role of hospitals. Please, sir.
Good afternoon, everybody. At the outset, I am extremely thankful to Government of Gujarat, all the senior government leadership present here. Pranjal sir, a special thanks to you for inviting us for this symposium, providing this opportunity to Narayana Hospital to share our thoughts. When I realized what is my time slot for the presentation, I thought of keeping it a little interesting, because I realized that we will be coming in the way between the lunch and the presentation. So please pardon me if I don't boast much about my facility, but I'll try to stay to the topic which has been assigned to me and which is very relevant for all the predecessors who have talked about it, about the infrastructure. But I want to ask this august audience one question. Tell me the one fact which brings the patient to your doorstep. Is it infrastructure? Yes or no? Is it the technology? It's not infrastructure, it's not technology, it's the trust. And if I start with that, I'll quote the example of our Honorable Chairman, Dr. Devi Prasad Shetty, who has recently quoted in one of the video, the current scenario what Indian healthcare is facing. If you see a pyramid, on one side we can keep the hospitals or the healthcare providers. On the second side we can see the health insurance companies. And on third side we can see the patients. Now the irony is, hospital don't trust the insurance company when it comes to offering the tariff, when it comes to offering the bills, when it comes to giving the approval letters. Insurance companies don't trust hospitals. They always try to get the best of the bargain. And finally, patients don't trust both these agencies. That's the scenario, that's the challenge country is facing. But definitely there is a ray of hope, there is an opportunity. And with that, I would like to touch the topic today, that how trust in healthcare system is the most relevant factor which will define, which will ensure that patients should come to your doorstep, patients should come to your hospital. whether it is global, whether it's local. And that is the most important aspect, because with that only, with that confidence patient and communities have in healthcare. And how hospitals plays a pivotal role in healthcare system, in my consecutive slides, I will try to touch upon that aspects. I'm sure this august audience must be aware it's a very minuscule thing for them, but I thought of sharing this across, that hospitals, we cannot segregate them from entire healthcare ecosystem. Be it preventive healthcare system, be it promotive healthcare system, be it educative healthcare system, be it curative healthcare system, hospital plays major role. Irrespective of their size, expertise, they are the indispensable sector in terms of providing the overall healthcare system or the services to the patient. In few slides, my predecessor talked about trust. Parth did discuss about patient safety and their accreditation. I personally feel, and Narayana as a philosophy, drive this as a genetical functioning from the corporate office to the unit level, that patient safety is on top. And we need to be transparent, not only ensuring patient safety, adhering to the patient safety protocols, but also to report that for our own improvisation, a continuous process with which we need to do a CAPA, in typical quality jargon, what to say, corrective and preventive actions, to ensure that patient safety is taken on utmost priority. As I discussed in my beginning talk, this is one of the important aspects and a deciding factor, that hospital bill and hospital operation must be transparent. Patient should be given all the treatment options, because with that, if the patient understands their rights and the services they receive, they are more likely to engage positively with that healthcare system or the hospital they choose to get their treatment served. Cultural competencies. In this diaspora, when we have experts, we have different states representative, we have different dignitaries from far outside of the Gujarat also. I try to correlate this analogy with the recent Makar Sankranti, 14th of January. When I saw this map and I realized one particular day, one particular festival, but look at the diversity, look at the way it is celebrated across the country. And that is what our beauty is, that we are different, but we are together. Vis-a-vis, if we replicate the same thing into a hospital scenario, when it comes to the service providers, the team of doctors, the nurses, the paramedical staff, the administrative staff remains the same. But when it comes to patient, it can be patient from North Gujarat, it can be patient from Rajasthan, it can be patient from NRG or from South Africa. You have to be receptive in terms of understanding their diverse need. And if you have that kind of cultural competency, definitely you would be able to do justice, not only to understand their needs, as well as to deliver the desired clinical or best healthcare to those patients. Community engagement is one of the important aspects which every hospital needs to have as a part practice these days. Since my topic is global trust, and I can boastfully say that this global trust does not restrict only to Ahmedabad or to Gujarat, it goes beyond the boundaries. And if that happens, it is a kind of success story, it's a cakewalk for the hospital to develop the client base or the patient engagement. When I refer Narayana Hospital, Ahmedabad, I can boastfully share the kind of aggressive community engagement as a hospital, as a healthcare provider we are doing. We, as a group, going again by the philosophy of our Honorable Chairman, Dr. Devi Prasad Shetty, who shared a recent vision. He says, we as a group want that patient need not to come to the hospital. It is more preventive healthcare which we should go and offer to their doorstep. And if that has happened, the cost of delivery of healthcare will be saved. It will actually reach to the deserving population. And that's how Narayana has recently come up with NH1 healthcare clinic across the country. A few examples which definitely are pictorial, and I can foresee the august audience can understand. But community engagement is very important to build a stronger relationship, foster trust, and simplest is health checkups and educational programs definitely can be offered to the patient to understand their healthcare needs, educate them, as well as to show the commitment for the community well-being. Our Honorable Prime Minister has recently launched ABHA, and the kind of thrust we have in terms of digital and digitalization, we all are part of that. But all I can say, as a group, we are equally kind of charge up Narayana Hospital. Our entire system is not paperless, but it is moving very aggressively towards EMR, electronic medical record system. The PHR, patient health record system, are also available. Here on the national side, with the blessings of Honorable Prime Minister and government authorities, government machinery, we are moving towards the whole digital platform where the PHR is going to share one single unique number. Your whole Kundali will be available on your mobile app. But yes, if that is a facility, there are challenges also. And in the recent October month, just 4 months back, one of the leading insurance company, the data was hacked. 3 crore insurance policy holders data was available in market. US also, we all have witnessed how the data hacking. So while there are pros, there are cons. All I can say here that it has, definitely it is a boon, digitalization, but it has its own challenge. And as a healthcare provider, as a hospital or as a group, we must ensure that it should be used ethically, securely to maintain patient confidentiality and the trust. A few challenges, definitely all active hospitals, especially corporate hospitals, my colleague would agree with me, we often face challenges in terms of handling patients, in terms of handling media, in terms of handling corporate queries, in terms of handling insurance queries. But the core, the fulcrum, if you see, usually all it boils down to 3-4 core elements, which if I have to name, could be miscommunication, it could be negative experience within the hospital or outside the hospital. It could be the outcome. As a patient, I have always the positive clinical outcome expectation, but I am the doctors or the technology is not God. We cannot replace God. If the clinical outcomes are not deserving or as expected, it may lead to some kind of confrontation. And finally, operational issues. I would not like to elaborate here, but you all are aware the experience of the patient during the course of treatment or from entry to exit experience of patient that makes the entire journey favorable or miserable. But the solution to that is one word, and that is proactive. Be proactive. When it comes to explain the possible clinical outcomes, be elaborative, be proactive. When it comes to explain the cost, please be proactive, please be elaborative. And if we have that proactive approach, definitely all these kind of challenges can be well taken care of. With that philosophy, Narayana Hospital as a group, we operate 24 locations across the country. We have our global presence with 4 operational hospitals in Cayman Island, United States. And we are a public listed company led by none other than Henry Ford of cardiac surgery, Dr. Devi Prasad Shetty. At Ahmedabad, we have 200-bed facility, which is NABH accredited, which is NABL accredited, PMJY Gold certified hospital. And we have highest Google rating, 29,000 positive Google rating across Ahmedabad. I can boastfully say we are on the leader. 4.9 is our rating. You can jolly well open the Google and see our ratings. These are the services which we are offering to the patient. All spectrum of services is starting from a general ward to semi-private, private and deluxe, to serving to all the patients of Ayushman Yojana and paying class and insurance company classes with all the kind of technological advancement available with us. We are center of excellence for heart transplant, kidney transplant, bone marrow transplant, TAVIs. These are the regular cases which we are doing. We are the first in East Ahmedabad to launch robotic knee replacement surgery. Few figures just to invite the attention of this august audience. We have completed at Ahmedabad 25,000 plus cardiac surgeries, 7,000 plus kidney and prostate surgeries, 6,000 plus knee replacement surgery, 30 plus bone marrow and kidney transplant, and 40,000 chemotherapies with OPDs 65,000 per year and with an IPD of 9,000 per year. That is all. In summary, if I had to say, coming back to the topic, global trust, and as I encompass the importance of trust, I request this august audience to bless me with your words and with your clapping that you agree with me. It's not the technology, it's not the machine, It's not the infrastructure, it's the trust which brings the patient to your doorstep. And if you're able to deliver that, you would be able to win the heart of the patient. And all I can say, it is as a healthcare provider, and since all the government authorities are also present here, I can say we should not only hold the hand, we should continue holding the hand. It's not only the curative, we should also be active in terms of preventive healthcare. If that happens, if the community is with you, nothing can stop you from your success. Thank you. Jai Hind.
Thank you, Mr. Bhatnagar, for your enthusiasm. We really enjoyed your talk.
We are honored to welcome the representative from HCG Hospital, who is going to present on the topic of Ahmedabad, the heart of medical tourism of Gujarat. Please, sir.
Thank you. So, at the outset, I would like to thank the organizers, Dhananjay sir, Chirag sir, and his organizing team. I am Dr. Sameer Batham. I am a senior consultant in the Department of Radiation Oncology at HCG Cancer Center. So, I guess this was not long back when Ahmedabad came into big pictures in India, when it became the first UNESCO World Heritage City. Well, now it is not just the heritage thing, but Ahmedabad is now one of the leading city where medical tourism is, is one of the most popular destination for medical tourism. Why? Because the city is home to a variety of world-class healthcare facilities. We have renowned hospitals, we have skilled doctors, and the treatment cost is very much affordable, especially when we compare to the other part of countries, especially like metros like Delhi and Mumbai and Chennai, while the quality of care is at par. Why Gujarat is preferred? Because, as I just said, we have a world-class healthcare infrastructure. The treatments are quite affordable. We have availability of specialized medical services, and the medical visa facility is also quite very much accessible. It is we have proximities to a good number of international airports. We get good government support, and the tourism and leisure opportunities are very much there in Gujarat. When we talk, since I am representing HCG Cancer Center, so this was the first private comprehensive cancer center which started in 2012, and this was the only center where we had all the cancer diagnostics and treatment facilities which were available under one roof, and we have set new standards of care in cancer care. The Gujarat's first tomotherapy came in 2016, and this is a advanced radiation machine, and in fact we were the first one to install TrueBeam in 2012. We have been pioneering in the treatments like advanced surgical things like HIPEC, which is hyperthermic intraperitoneal chemotherapies, which is used in many of the peritoneal and ovarian cancers, the pressurized intraperitoneal aerosol chemotherapy, or the PIPEC, the advanced CO2 laser treatments. And when we talk about the chemotherapy part, we were the first one who introduced the scalp cooling therapy. This was the first one in Gujarat. So when we talk about the comprehensive cancer care, the three major pillars: surgical oncology, radiation oncology, and medical oncology. And I can proudly say that we are having all the latest and the best possible infrastructure which is needed for cancer care, whether it is the Da Vinci Xi robotic system, or the CO2 laser, the nerve monitoring, microablation, the intraoperative ultrasound, or the 4K endocard laparoscopy, the Optimus stroboscopy system, and the HIPEC. When we talk about medical oncology, all the facilities for targeted therapies, hormonal therapies, chemotherapies, and immunotherapy are available, everything under one roof. Radiation oncology, as I just said, we were the first one to introduce TrueBeam and tomotherapy to the state. We also have brachytherapy, which is a very integral part of cancer treatment. So this is our strength. Since 2012, ever since the HCG started, we have treated over 19,000 cancer patients with surgeries, over 2,000 robotic oncosurgeries, over 8,000 PET scans, 80,000 plus patients we have seen so far, of which 30,000 patients were IPD. Over 40,000 patients have received chemotherapy at our center, and over 12,000 patients have received radiation. Now we have recently shifted to a bigger and a better place. Now initially we started with some 60 plus beds, and now we have moved to a place where we have 217 beds, where we have dedicated 23 surgical ICU beds, 10 advanced medical ICU beds, and 23 daycare chemo beds. We also have the most comprehensive BMT units. We have 12 operation theaters and 16 pre and post operative care beds. This is the only center, and again I feel proud in this, that we are the only comprehensive center in private setup where we practice in subspecialty. Like, we have a dedicated team of oncologists who takes care of breast cancer, head and neck cancers, the uro cancer, and likewise. So we are the only center who practice in subspecialty, and this subspecialty is not just limited to surgical oncology, but this is in radiation and medical oncology as well. So regions, when we talk about the international patients, these are the regions we primarily cater. Most of our patients, they come from East African countries like Kenya, Tanzania, Uganda, Ethiopia, West African countries like Nigeria and Ghana, Middle Eastern countries like Oman, Bahrain, and UAE. And we have overseas team who visit Kenya and Tanzania frequently. The key services in international patients are the medical consultation and the specialized treatments, the advanced treatments, the surgical intervention, and the health screening and preventive care is all what we provide. The supportive services, which are very essential, especially when we talk about the international patients, are all provided by us, like the quick response to medical queries, medical visa assistance, the free airport pickup and drop facility, the dedicated relationship manager for end-to-end assistance, the choice of accommodation and meal, the language translation assistance, the foreign currency exchange facilities, or the payment through all major credit and debit cards. These all facilities are available. The insurance, which again is a very important part in treatment, especially when we have international patients. So we have insurance alliance with major international insurance companies. The local travel arrangements for shopping and sightseeing are also available. Digital transformation is something which is coming up in big way, and telemedicine is again an integral part of our system. We cater many of our patients, and many of our international patients use the facility of telemedicine from our center. This is our team who recently visited Tanzania. Extreme left is Dr. Tanesha, who is our breast surgeon, and we keep on organizing the various community programs and CMEs in African countries, and we get very good response from there. This was a meeting which we had recently in July 2024 in our new hospital, where we were honored to host over 45 insurance delegates from various countries, including Kenya, Bangladesh, Ethiopia, South Sudan, Uganda, and these representatives were from various insurance companies like Minute Insurance, UP Insurance, etc. Thank you. In addition, so although HCG is known for cancer care, we also have a dedicated multi-specialty hospital where cardiac patients, ortho, and all the multi-specialty facilities are available. Thank you. Thank you.
Thank you, Dr. Sameer, for your insights.
Now, we would like to welcome Dr. Simardeep Singh Gill from Sterling Hospital to present on the topic of expanding access, future of global healthcare. Please, sir.
Thank you, Dr. Chirag Joshi and the UN Mehta team for having us on this platform. My sincere thanks to the government of Gujarat for supporting and encouraging these very, very useful platforms. While my topic is very different from medical value travel and medical tourism, but over the last about an hour or so, we saw 10 odd speakers presenting across their facilities, and what comes across very clearly is that Ahmedabad is completely ready to be doing what the bigger cities, the so-called medical value travel cities of India, be it Delhi NCR, be it Chennai, be it Bangalore, are doing. I mean, from a mammoth GCRI to a UN Mehta, the kind of work these organizations are doing, I don't think it's comparable to anywhere in the world. So I guess as a city and as a state, we sit on a great opportunity, which is this larger basket of medical tourism. And in the coming years, I'm very hopeful that we will attract a lot of patients from across the world coming into Gujarat. Just shifting gears. So just give me a minute. Yeah. So, you know, this is more on, this is the healthcare scenario as far as the overall globe is concerned. If we look at some data, statistics, the healthcare spending is to the tune of $9 trillion in 2022. Health inequality is there. More than 2 billion people lack access, and there's a massive workforce gap, and then there is telemedicine, which is post-COVID, which is surging hugely. The challenges which are being experienced are obviously these pandemics, which have disrupted systems either in smaller parts of the world or the larger part of the globe, which we saw. Economic crises keep on happening in different parts of the world. Resistance to change in adopting new healthcare models, and ethical concerns regarding the AI, which all of us are aware of. What is the way ahead as far as the future is concerned? I think digital innovation is the number one thing, at least over the next 5 to 10 years, which is the way forward, which includes telemedicine, which includes wearable technology, and big data AI, as I said again. Affordable and scalable solution is another important piece as far as the way ahead is concerned, which includes generic medication, point of care diagnostics, and community health workers. Healthcare infrastructure continues to be a very important component, and decentralized facilities and renewable energy integration is something which would play an important role in the coming years. Policy and funding, most important part. Governments, international bodies must prioritize policies which help setting up of hospitals across all levels, primary, secondary, tertiary, multi-speciality, single speciality, innovating financing and subsidized insurance program, which, by the way, we are doing very fairly successfully in our state. Global collaboration, we've seen during the pandemic preparedness, equitable vaccine distribution and knowledge sharing. Emerging technologies, that's another piece which will play an important role in the coming years. What are the factors which impact global healthcare expansion? Political factors, all of us are aware, are very important. There are positive political factors, there are negative challenges or negative political factors. These have to be kept in mind. I'm not going to read through all the points, but by and large, an important factor from a stability and an expansion perspective. Economic factors, needless to say, play an important role. Money is required when we set up brick and mortar facilities wherever in the world, so that plays an important part. Social factors, positive ones are increasing general health awareness, growing focus on inclusivity, telemedicine, and challenges are cultural stigmas, illiteracy. And then comes to the technological factors. Again, most important piece or factor which is going to play an important role in the coming decade at least. So advances are in AI and sensible usage of AI and breakthrough in personalized medicine and biotechnology. And challenges, needless to say, are cybersecurity being a very big one. An environmental aspect, there are positive factors, there are challenges. Similarly, there are legal aspects, there are positive aspects, and there are challenges. So these are all, in a nutshell, the scenario for which is applicable to pretty much every part of the globe, every geography, every city, every town, for us to be able to expand and explore the provision of healthcare access to each of the patient or anybody who requires it. So on that note, thank you again once to the organizers. And at Sterling, I represent Sterling Hospitals, which is Gujarat's first corporate chain of hospitals. Ironically, the next Monday is going to be our 23rd anniversary. Our first hospital was inaugurated on the 20th of January 2002 by Honorable Prime Minister Shri Narendra Modi. He was the Chief Minister of Gujarat at that point in time. And over the years, the group has expanded, and today we run 6 hospitals across 4 cities in Gujarat, all multi-speciality, focused on oncology, cardiac, orthopedics, and all other specialties. So all of us in the private sector, my speakers before me, and in the public sector, I think we are ready with that great platform to be able to provide any sort of healthcare, to be able to fulfill any sort of healthcare need for people from within the state, within the country, and overseas. Thank you so much.
Thank you so much, Dr. Gill. We are grateful for your presentation in our event. We are once again thanking you for speaking with us.
We have reached towards the end of our event. I hope all of you have enjoyed these informative presentations and leave here today with an increased sense of collaboration and cooperation. With a rich experience of 2 decades in interventional cardiology and an indispensable part of the UNMICRC family, I request Dr. Subhashish Sahu sir, Professor of Cardiology, to deliver the vote of thanks and concluding remarks. Welcome, sir.
It's a very good afternoon to all. As we conclude this momentous event, Global Health Transforming Lives Beyond Horizons, I would like to express my deepest and most sincere gratitude to our Honorable Health Minister Sir Sri Rishikesh Bhai Patel, Principal Secretary, Health and Family Welfare Department, Government of Gujarat, and Chairman, Governing Board, UN Mehta Institute of Cardiology and Research Center, Sri Dhananjay Dwivedi Sir, and Secretary, Department of Tourism, Government of Gujarat, Rajendra Prasad Sir, for their valuable support and guidance in making Global Health Transforming Lives Beyond Horizons event a resounding success. We extend our heartfelt gratitude to the Indian Institute of Public Health, Gandhinagar, for their invaluable support and partnership. Without their collaboration, this event would not have been possible. Our sincerest gratitude to our esteemed ambassadors and distinguished foreign guests who have joined us from around the world. Your presence has enriched our discussions and reinforced the global significance of our collective efforts in healthcare. Special thanks to our Medicity stalwarts, Professor Dr. Shashank Pandya, Director of Gujarat Cancer Research Institute, Ahmedabad, and Professor Dr. Pranjal Modi Sir, Director, Institute of Kidney Disease and Research Center, Ahmedabad. Thank you so much, sir, for your hard work, dedication, and team spirit. I would also like to extend my heartfelt thanks to the representatives of public and corporate hospitals who have come together on this platform to share their expertise and forge meaningful collaborations. I extend my heartfelt appreciation for your active engagement and contributions to the event. To our speakers, organizing members, UN Mehta Institute team, and Medicity dignitaries, and also all those who are involved actively in this event, I offer my deepest appreciation for your tireless efforts, dedication, and commitment to excellence and making this event a grand success. This event's grand success is a testament to your collective efforts, and I am honored to have shared this experience with each and every one of you. Thank you all once again for your participation, engagement, and commitment to transforming lives through global health initiatives. Thank you.
Thank you, Sahu sir. I thank you all for your presence here today. After this, we have arranged for a tour of the hospital for you, where you can see firsthand the services and infrastructure that we have to offer.
This hospital tour will be followed by lunch. So we'll request you all to go for the hospital tour with our representatives, and then we have the lunch in the designated area. Thank you so much once again to all the delegates and distinguished guests. Thank you so much.